Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. This is Jamia TV. My name is Kasim Mustafa and this is Health is Wealth. This week we're talking about breast cancer. Joining me in studio is Dr. Batul Gulam Hussein, a medical officer. Daktari have been with us since last week, and last week we talked about very many things with regards to breast cancer. What causes breast cancer? What is a breast cancer? How is it prevented? That is the question that I think we will have to start it from here, because they say prevention is better than cure. Daktari, before I even introduce that question to you, salimia mtazamaji, anashangaa leo tumeanzaje topic kama hatujawasalimia.
Assalamu alaikum all of you, and I'm happy to be here and continue the second segment of the show.
Yes.
Karibuni sana.
Asante. So wanasema prevention is better than cure. Sasa swali ambalo sisi tunajiuliza na watazamaji huko nyumbani ni, can breast cancer be prevented completely?
So that's a straight no. Okay. You cannot say that you can prevent breast cancer completely. Remember, we talked about last time the modifiable and the non-modifiable factors. So there are things which are not within your control. If you remember, we talked about age, we talked about genetic mutations. So there is no guarantee of what gene you've inherited. So that answer is a definite no. You cannot completely prevent breast cancer.
Now, what are the lifestyle habits that someone should do to prevent or rather be away from getting this serious illness?
Okay, so basically now these are digging into now the modifiable ones. So we are looking at physically active lifestyle. Someone who does exercise regularly, at least 30 minutes every day, whether it's walking, running. We are now also looking at diet. So too much sugar intake, fatty food intake, again obesity and weight, excess calorie intake can also predispose you to getting breast cancer. We are also talking about alcohol intake. That is a very major thing, which has been linked with developing breast cancer. So if we can adapt lifestyles which are exclusive of that, then the better for us. Also hormone replacement, it's a choice, remember. There are different types of hormone replacement therapies which come for menopausal women. If we can avoid them, the better. Oral contraceptives, like we said last time, to some degree. And even then we have now the IUCDs, the contraception, mechanical barriers and all that, which can be used and can really prevent or reduce your risk.
Before we get into stages and types of maybe the stages and grades of breast cancer or types of breast cancer, I'm having a lot of questions, and of course in anything that we do or we engage in, there must be a myth and misconception. Do you have any common myth and misconception that you've heard about breast cancer?
So many of them.
Highlight them for us, maybe.
Yes, because you find that the lack of awareness plays a major role, and you find many women having so much stress about so many things, and what are the possibilities, what if this causes breast cancer, and some of the common ones I have heard is using deodorant or antiperspirant causes breast cancer. That is a myth. It is not a fact. I've also heard of people saying that wearing a bra which has underwire can cause breast cancer. That is also not true. It is a myth. Other things are things like getting a lump means breast cancer. So a lump does not equivalent to breast cancer until diagnosis is done and it is proven to be cancerous. What else? Some people say that men can never get breast cancer because men don't have breasts. But that is also untrue. Yeah, we have already established that in the last episode that men do have some breast tissue.
Tissues, yes.
Yes, and that can also predispose them a 1% chance. Yes.
You did mention about antidaras. What did you say?
Antiperspirants, the deodorants. Yes.
Now people want to understand what are these
Perspirants.
Antiperspirants. So, ladies and gentlemen, that terminology is not mine. You know, I'm a journalist. So journalists don't understand all the medical terminologies. That's why I want Daktari to help us, to help me and help you back at home understand exactly what it means, Daktari. They are confused.
Don't worry, we'll clear that up. So antiperspirant comes from the word perspiring. Perspiring means sweating. So some people like using these roll-ons and sprays in the underarms to prevent that smell from the armpits or from the sweating, or prevent excessive sweating for those who sweat a lot. But there are some people who believe that applying those chemicals, or rather those sprays or perfumed roll-ons, predisposes you to cancer. So that is the one we are saying is not true. It does not, it's a myth. Yeah.
Maybe many people delay, they do delay seeking medical attention even after noticing the warning signs. What might be your advice? Because very many people might be having a change of skin, but they are like, no, maybe it is just because of heat. It's just, you know, people have a lot of, we've talked about myths. So someone might be having a myth that sometimes maybe this is just the change of skin for today. There is no problem. So how important is seeking medical attention important? Because this one, they are delaying. Yeah.
So I think it's important to understand why are they delaying. Yeah. What are some of the reasons someone would not want to come out with it? So the first and the most commonest is fear.
Okay, fear.
Okay, the general fear of what if it is breast cancer? So now this is a death sentence. You know, many people will in their mind, all sorts of things will go on. Maybe they had the whole plans of their lives, you know, and suddenly now there's a lump. And in their mind, they've already made it up that now that is cancer and this is it, you know. So the fear stops them from facing the reality.
Yes.
And then, of course, denial. Maybe all the signs are there, but they're in denial. They don't want to share with the family. They don't want to tell anyone about it. And they literally just don't want to go to the doctor. Other reasons include things like finance, you know, maybe they already know that, you know, now this one, there is no treatment. You know, most people associate that cancer, there is no cure and there is no treatment. Of course, there are things that can be done, maybe not so easy, surgery and radiation and chemotherapy, but nonetheless, it can increase your chances of survival. So there are also traditional beliefs, cultural beliefs, religious beliefs, you know, and some people resort to traditional medicine thinking that, you know, this one will go away, maybe just out of ignorance or lack of knowledge or awareness.
Yes.
Yeah, but the message is very simple and clear for our viewers. You find you're not comfortable with a change on the breast, or on any part of your body for that matter, consult.
Okay.
Yeah, the fear is not helpful. Rather, doing something about it is more constructive.
All right.
Yeah.
Now we get into the big topic now. This is where many people want to understand. There are types of cancer, right?
Yes.
Breast cancer. So you help us understand the types of breast cancer.
So there are 4 main types of breast cancer. Remember earlier when we started the session, we talked about cancer which in the breast starts from either the milk ducts.
Yeah.
So we call it ductal carcinoma. That's one type, okay? Or it can start in the milk lobules, the gland itself, which produce milk from the breast, which we now call the lobular carcinoma.
Okay.
If it is now starting to spread in the milk ducts, we call it ductal carcinoma in situ. Okay, now that is the 3rd type. I think the fourth type, we also talk about the triple negative breast cancer.
Okay.
This usually means that, when we diagnose breast cancer, there are some hormone receptor tests and protein tests we carry out.
Okay.
So the treatment of a triple negative breast cancer is very different because they're negative to those receptors.
Okay.
So their treatment is much different from what you would do for ductal carcinoma or lobular carcinoma or ductal carcinoma in situ. Yeah. So those are the four main types, to put it simply.
Okay.
Yeah.
Maybe let's help them understand this: ductal carcinoma, lobular, ductal 3, and triple negative, by small explanation for them so that they differentiate between ductal 3 and ductal 1, because ductal 1 is ductal carcinoma, then the other one is ductal carcinoma 3. Yes, in situ, yes. In situ or
in
C3?
situ.
In situ.
Yeah.
So you help us understand that, then I think we'll move to the stages.
So let's just put it simply.
Yeah.
Ductal in the milk ducts. Okay. And it may have just affected 1 or 2 ducts there. Yeah.
Okay.
Lobular is the milk glands.
Okay.
But ductal carcinoma in situ is now more than 1 milk duct surrounding in that area. Yeah.
Triple negative?
Triple negative is what I was telling you about, hormone receptors being negative.
Okay.
So usually when we take out a biopsy, what we now also test it for hormone receptors, HER2 proteins. So when all those are negative, when the estrogen receptors, the progesterone receptors are negative,
yes,
and including the HER2 protein is negative, then you have that particular. So the treatment now here differs. Yeah.
Okay. Now we move to the stages.
Yes.
Because of course, these are just the types. Now the stages. We have those stages which we are told, when you are in this stage, you are over. These are people saying,
yes,
and that's why they treat breast cancer as a death sentence. So help us understand the stages of breast cancer.
All right. So of course, like most cancers, there are stages. Of course, staging is different. In the breast cancer, also we use the TNM staging. There's stage 0 to stage 4. All right. So there are 5 stages in total. Okay. So the first stage is completely non-invasive, or rather we call it stage 0, which is non-invasive. Okay. It's really literally in the very earliest of them. Okay. Now stage 1, we have 1A and 1B.
Okay.
All right. Now that is where the actual you can actually palpate or feel a lump.
Okay.
So we are looking at a breast cancer. The size is less than 2 centimeters. The lump is less than 2 centimeters in stage 1. Okay. Okay. Now the difference between stage 1A and 1B. Yes. In 1A, it is less than 2 centimeters, but there are no lymph nodes involved. Okay. Okay. Remember, we said there are those lymph nodes in the axilla, in the underarms, and even around that area. Yeah. But stage 1B, the size of the lump is less than 2 centimeters, but there are a few lymph nodes, 1 to 3, involved. Okay. Then we look at stage 2. Okay, stage 2, the size of the cancer or the lump is between 2 to 5 centimeters. Okay. Okay, so now the size increases, and of course there is lymph node involvement. Okay. When we look at stage 3 now, of course, this one is a large area of above 5 centimeters. So basically we are looking at the size of the lump, which is involved. And finally, stage 4 is a term we call metastasis. Metastasis. Okay. Yes. So those are the 4 stages of breast cancer. Metastasis simply means spread. Okay. Yeah. And breast cancer can spread to any organ. For example, the next breast. Okay. Yeah. You could have it on the right, and then now it spreads to the left, for example. Or it can be the lungs. It can be the thyroid, ovaries, so on and so forth.
All right. Stage 0 is non-invasive.
Yeah.
Then that means stage 1, 2, and 3 is invasive.
Yes, yes. Now it is actually starting to infiltrate and spread.
Yes. So it is spreading in the body cells and blood cells.
Yes, through blood, yes.
Through blood. Now we come to metastasis.
Yes.
Which is now the fourth stage. So because I don't want us to go deep into treatment, but now at what stage is a patient safer?
So of course, even up to the age or up to the stage of stage 3,
yes.
Of course there are chances. Yeah, there is options. Like you said, the surgery we can do. We can even do chemo, radio. Yeah, depending on what exactly is going on. Yeah.
Yeah.
But with stage 4, yes, now here the chances look much more grim.
Yeah.
And it will really depend on which other area it has spread and what can be done, how early it was detected. Yeah, remember, even someone who is a breast cancer survivor needs to have almost biannual or even yearly checkups to make sure and monitor for metastasis or spread or maybe another resurfacing of another tumor in another area.
Okay. Yeah. Mashallah, the topic is becoming more interesting because I want to get into treatment options. But now, looking at the time, we cannot highlight this. We cannot discuss this. But now, Daktari, what advice will you give people to who discover lump or any unusual change in breast? Because, of course, we've talked it many times, but now I'm insisting on this because many people exactly doesn't know if this happens, what should they do? And we said a lump can be one of the signs, right?
Yes.
So what advice do you give them before we wind up with the show?
So my advice is not an easy advice to take. Telling someone don't fear is a tall task, especially for the actual person who's actually going through that.
Yes.
But what I would say is truly don't just fear or have anxiety. As you have seen and as we have talked about, a lump is not a death sentence. Okay, investigate.
Okay.
Get to the next person. Talk about it. You see, the mistake many of the times we make, and even sometimes our elderly, is keeping quiet about it, maybe because they don't want to stress their children or worry them and all that. But mine is to say is alert early.
Yes.
And when you alert early, you can get to the next step much faster. And the next step is basically visit the doctor. Okay. Visit the doctor, do the screening tests. If need be an biopsy or a needle aspiration needs to be done, get it done. It's better to know and then worry than not know and just worry in vain.
Okay.
Yes.
It's better to know.
It's better to know and then worry about it and say that, okay, fine, now I have it. So yes, now let's deal with it. Yeah. Yes. But rather than worry and not even be sure that it is breast cancer, that is a bit sad. So it's good to actually, take the next step. You have to be very brave. Women have to be very brave about it. It's not easy. The fear is very crippling many of the times. But you have to try and overcome it and, talk about it with your closest family member, especially when you know your mother or your sister or your, it's in your family, the first degree relatives. Then it is very important that you regularly screen.
Mashallah. It is very important that you regularly do screening, right? So Daktari have highlighted very many things in this topic. And as I said, time is not allowing us to complete this topic. This topic is a bit wide, and when we rush, we will not help you, our dear viewers back at home. So join us next week again, whether I'll get Dr. Batul or another doctor. We talk about treatment options. But before we wind up the show, Daktari, you might be having very important messages to our viewers back at home. If you have them, please give them.
Mine is to say, don't fear to screen.
Don't fear.
Just don't fear to screen. Screening, detecting early is knowing and leading to better outcomes. Yeah.
Mashallah. So she said, it's better to know that you have it and work on it, that not knowing that you have it, then die when you are having it. I'm not saying you'll die, ladies and gentlemen, so don't misquote me. So inshallah, we meet next time, next week, inshallah, same place, same time. I've been your host, Kasim Mustafa. Until next time, masalam. Let's meet in the same topic. Remember, there are different types of cancer. When we finish breast cancer, inshallah, we will move into a very serious cancer again. Prostate cancer, cervical cancer, throat cancer. Don't you worry. We will be here to help you understand all this. What causes or what brings up all these types of cancer? We will highlight them in our next episode. So do not go away. My name is Kasim Mustafa.